November 8th is the International Day of Radiology, and this year the day is dedicated to breast imaging and the essential role that radiology plays in the detection, diagnosis, and management of disease on the breast. As a result, the Radiology Department within the Ministry of Health, Wellness and the Environment for the first time held a series of awareness activities, including a custom appreciation in commemoration of the day. The staff was enthused and the patients pleasantly surprised and grateful for the initiative. Here are highlights from the day. So I'm here with Mr. Pedro Richards, and he's the Chief Radiographer, and today is World Radiography Day. Your department organized an activity for the patients to give back to them. Tell me a little bit about that.
Yeah, as you mentioned, it's World Radiography Day, which is the 7th of November, and just before mentioning today, it started back in 1895 in Germany when X-rays were discovered, and so it's quite a time now. And every 7th of November it's World Radiography Day, and we chose today to show some customer appreciation, and we wanted to emphasize mammography. Mammography is one of the important areas for female, and we wanted...
And that looks at the breast for persons who don't know.
That's right. So we wanted to show patients the importance of regular checks, and therefore we made that area, and as I mentioned, emphasize mammography. And we were hoping to do some patients who we would just pick from the number who visited the hospital today. That didn't happen as we would plan, but still the publicizing of the documents of patients is what we at least achieved, so that persons could at least go visit their doctors regularly. That's important, and do mammography. Other than that, the field has expanded over the years into imaging, and we have different forms of the same radiography, such as CT, and then imaging, ultrasound, and MRI. So the field has expanded. It's a whole field, whole area of imaging, starting with radiography on the 7th of November 1895, and today is one of those days, anniversary days.
How did the patients respond to this?
Yeah, persons would have been, I would say, pleased at least to have appreciation. The important thing is that how they respond in the future, meaning that the leaflets like that, how they respond to it will be the important area, meaning that we would like them to follow up.
So you hope to see behavioral change?
Yes. Following up meaning that regular visit their doctor and have discussion, and which they can do at least screening on a regular basis, so that they can show some benefits for them in the future.
Any further encouragement to persons?
Yes, well, what we do as well, we try to keep the radiation dose to the minimum while we maximize the diagnosis. And the advice to the patients is they don't have to be worried about the effects of radiation, while we would have to do various x-rays from time to time, because we would use our knowledge to limit or minimize the amount of radiation to the patients. Therefore, they can go and have their regular checks, and we will play our part in the diagnostic of their diseases.
All right, thank you so
You're
much.
most welcome.
All right. Today, and we're at the radiology department where they're showing a customer appreciation. This is one such customer who is being appreciated, and she's going to tell us her name and how she feels about this.
Okay, my name is Sharon Richards, and I feel good about it. And I do appreciate as we continue coming to the hospital. We appreciate all the doctors and nurses in whichever department, and I wish them all the best in Jesus' name. Amen. Well, the first time I've come here and received something like this, not because I'm hungry, but it's just that. But it's a good gesture. What they did is good, and I appreciate it. And I pray that everybody else appreciates it.
We're here with Sister Anita Scott, and she's also a beneficiary of the goodies that are being distributed here from the Radiology Department. How do you feel about what is happening here today?
Well, to be honest, I feel good. For my years working in hospital, every falls, I'm experiencing appreciation the radiologist. And I think it's a great gesture.
How do you see from being here so far a person responding to what is happening?
So far the response is very good. For the few persons that came in before, the response is very good. And I think persons were caught by surprise. Most of them who came in thought they were caught by surprise. So they kind of like the wow moment, the wow moment, sorry. Yeah.
Okay, so you think persons are responding positively to it and it would have boosted the way people feel about being at the hospital?
Yes.
Alright, thank you so much. So we're here with one of the workers of the Radiology Department. You guys are giving back today's World Radiology Day. How you feel about being able to give a different vibe to the patients that come here?
Well, I think it's a good issue because for years of being here working, actually it's the first time we try to execute this task. Actually, it's just a little stuff we started, it's just to give back to the patients and the public and inform them of the importance and the effect of radiography.
Okay. What has the response been like so far, and how does that make you feel?
Well, for the patients, it was a surprise because every day we have patients day by day, and they never accept something like this. So I think they was just caught by surprise.
And it makes you feel good?
Yeah, I mean, to give back to the public, it's a good sign.
Alright, thank you so much. What is your name?
Chevron, Glendon.
And what is your role here in the department?
I'm a student radiographer currently.
Okay.
Yeah, so I perform as a radiographer by doing x-rays and so, but not the CT scan part of it as well. Yeah, that is done by a radiographer.
So exactly how does this work?
This one, if a person is going to do like an abdomen x-ray, you will lie on the table here, and then you just center them. There's a grid line, like you could center with the navel. Yeah. Just press this 2 times till you move left, right, up and down, all around, just to be able to center the patient. Yeah. And every patient dosage is different, because if it's a skinny person, then you'll have to reduce the dosage of radiation.
Right.
Yeah, if the person fat like me, then you'll increase it.
Okay.
Yeah, if it's a chest, then you rotate it all the way around to line up with the chest stand over there. And this what it's doing is called coning. So you're just reducing the amount of radiation it's containing it into the area that you need.
Okay. And then somebody else sits there and control it?
No, after you set up, you go around and you change the values and then you expose.
Okay.
Yeah.
So pretty much, why is it important to talk to people about radiation for them to know what radiation is or how it affects them?
Yeah, because some radiation, the dosage could be dangerous for some people, especially if they're pregnant. Right? If you're probably around 3 months pregnant, we have signs in the rooms here, just in case we ourselves forget.
Right.
Yeah, you see, we have signs. If you're pregnant or you suspect you may be pregnant, you have to advise the receptionist and the radiographer before you exam. Right, but they have the doctors. This is actually the doctor's job, for them to inform you, to find out when is the last time you did an X-ray, or the period in between you did the last couple of X-rays, and if you're pregnant.
Okay.
Yeah.
So today you pretty much use the opportunity to give back to the patients as well as to inform them about the harmful effects of radiation.
Right. And actually, the patients are paying us
Right.
So we just it's kind of like we just giving like charitable food, drink, snacks, just to say thank you for coming and come again. Right, and here we have the control panel for the CT scan machine. Right, so this one what you're looking at here is a CT scan of the head, well, of the brain also. Yeah, so the radiographers will come here along with the radiologist to enter in the information and to do the actual graphing of the patient and so on. And the radiologist will insert a contrast dye into the patient just in case, well, if they really need it, if they see the need is. Yeah, so. And this is, you could actually hear what the patient is saying, get feedback, and speak to the patient from here by pressing this button. Okay. Yeah, just in case the patient is uncomfortable or anything.
Right.
Yeah, if you come this way. Okay, so this is the CT scan machine. Yeah, it's pretty neat. You can do any part of the body that the doctors need to CT scan on. So this is if the person got in an accident and they have they're checking for internal bleeding in the head or hemorrhage or in the stomach area. You just put the patient to lie, the head goes here, and then you adjust the table from either these, up, down, left, right, or there's a foot pedal on the other side, and the ground right there. There. And then the patient is strapped in with this, and it's a nice soft bed just in case. The procedures are usually quick though. Takes about 3 minutes for some, and up to 15 minutes for some also. Yeah.
The initiative is aimed at making patients more aware of radiology and mammograms, as well as to help stress the significance of the department's specialty in breast health care. The event reflects another key objective of the organizers to raise awareness of the necessity of using appropriate radiation doses in medical imaging. So we're with Siobhan Stewart, and she's the radiographer here in the radiology department, and she's going to explain to us a little bit about this machine that we have here, and she's going to tell us about who and what inspired the initiative for World Radiography Day.
Okay, World Radiography Day is November 7th around the world, and in most countries there's something done to commemorate that day. We here at the Radiology Department in St. Vincent decided to do the same thing this year, and we plan a 3-part event. We focus on mammography because we have a lot of breast cancer cases. Figures demonstrate that we have a lot of breast cancer cases being discovered in St. Vincent, and though radiography is a wide field, we just decided to focus on mammo this year. So we had literature printed explaining to patients basic information: who should have a mammo, at what age you should have a mammo, how do you go about making a mammo appointment at the Milton Cato Memorial Hospital, the cost of a mammogram here at the Milton Cato Memorial Hospital, basic stuff: what should you do on the day you come for your appointment, what should you wear. So we are going to give patients that information so they have it at hand. We've made it as simple as possible so that all patients could read the information. The second part is we have decided, when we're giving out the literature, that we are going to interview persons who are within the screening age, find out if they've ever had a mammogram. And if we find persons who have never had a mammogram in the screening age, the hospital administrator has agreed to exempt 5 persons. So we give the 5 persons the opportunity to have a mammogram today, free of cost, which we hope will help in the screening process. And the final part is that we want to treat patients who come to the radiology department today by offering them a snack plate with a hot drink or a cold drink.
What is the screening age though?
Well, in St. Vincent we go from 35. basically 35 to 55 years of age, as a female, you are required to have a mammogram, at least one mammogram every year.
What about males? There have been incidences where there have been it's in the minority, suspect cases of breast or lumps in men.
Well, with the male, unlike the women, where it is expected, it is mandatory, we ask of you to do it every year as part of the screening process. With men, we ask that if you feel something,
Right.
so you don't come for it like a regular test like a woman, but if you feel something uncomfortable in the breast area, then you go to your doctor and you let him know and have him request a mammogram for you.
Okay, so this machine is...
Yes, this is the mammogram machine.
Okay.
This is the one we have here at the hospital. It's quite simple. What will happen is that this is the compression paddle. This will lift when we mash these levers here. We put the breast tissue in between this area and then we mash down slightly. It compresses the breast tissue. You feel some discomfort, yes. As the sign says, we compress because we care. So it is part of the process. You feel some discomfort. It only lasts for about a few minutes, 2-3 minutes per breast, and it's over. And basically we do 4 images for each patient.
But if you have like really small breasts, it's more difficult than if you have like bigger boobs?
Yes, it's hard because then we have to pull that breast tissue a bit over and put it in this compression paddle, but we still get it done. But if the breast is so tiny that we realize that, we're not going to capture much, then we recommend ultrasound.
Oh, okay. All right, why is the focus on breast?
The focus is on breast, like I told you, because we are seeing an increase in breast cancer numbers in St. Vincent and the Grenadines, worldwide actually. And we find that a lot of women are not taking the mammography as serious as they should. They are not going to the hospitals or their doctors and asking to have a mammogram exam done. And it should be. Once you hit the age of 35, you should make it just like a pap smear that you have every year, a yearly exam that you do. If you want to keep record of whether I have one or not, schedule it on your birthday so that it's automatic a reminder. This is my birthday, today's my birthday, so I should be making an appointment to do my mammogram.
Okay, that's a good tip. I spoke with a couple of the patients and their response was like, wow. I saw their expressions. This is the first that they're coming and getting something. What inspired the initiative to do this? Giving back is always a wonderful thing, and I think it caught a lot of the patients by surprise, pleasantly. How do you feel about that, and what inspired it?
People like to receive. People like to receive. Coming to the hospital is not a pleasant experience to most persons. And if you can come to the hospital one day and you have a pleasant experience because you receive something you didn't expect to receive, you get a little, then you start saying, oh, I went to the hospital that day, but I never know what happened. And it's something that I wanted us to do in the department for a long while. I wanted us to take Radiography Day serious and do something about it, but I guess we probably never had the time or the staff or the resource to make it happen, and this year was just one of the years that everybody got on board and it was able to happen.
Okay, and how do you feel personally about that?
I am happy that it took place this year, and I hope that it would happen every November 7th going forward.
Alright, are there any final words of encouragement that you'd like to leave with persons concerning mammography or radiology on a whole?
I just want to say that radiology examinations are important. On the radiology examinations, you have basic x-rays, CAT scans, ultrasound, mammography. That's what we offer here at the hospital. And I know sometimes it could be difficult to get an appointment, but we are one department and we have just one machine catering to the public. But bear with us, don't make the fact that the appointment date may be a little far out deter you from having your exams, because they are absolutely necessary. So come to the department or call us 456-1185 extension 128 to schedule your appointment. go to your doctor, get the request for them, and make an appointment, get your radiology exams done.
Okay, well, on that note, I'm going to say thank you, but I'm going to put you on the spot a little bit. I'm sure everybody's going to watch that expression. I'm going to put you on the spot a little bit. Because we try to improve the service that we offer in the Ministry of Health, Wellness and Environment to the general public, some concerns that persons would have is that if a doctor gives me whatever recommendation that I need to get this exam or this x-ray done, with the increase in cases of, you know, cancer, different types of cancer and stuff, how do the department make a critical decision in terms of priority? How do you treat the cases in terms of, because if it is a cancer, remember there can be a difference between finding out at stage 1 as opposed to finding out at stage 4. How do you prioritize and know which cases, or do you prioritize and give cases based on what may be happening, or it is just a standard treatment across the board that people just have to wait this duration of time until they get the examination done?
No, well, firstly, it depends on your doctor and what your doctor states on the request for the examination.
Okay.
If your doctor gave us full details to work with so we can assess the situation, then based on the situation, you'll get a priority appointment. If we, the radiographers, or the other members of staff are a little confused and we're not certain about this, how severe the case is, we refer the request to our radiologist. We have 2 radiologists, Dr. Ambrose and Dr. Johnny. We refer the request to them, they take a look at it, and they will let us know if this is an urgent case that needs to be done right now, if we could schedule it in the next 2 days, or if we could schedule it in another week or 2.
Okay, thank you for that clarity, because a lot of persons, you know, sometimes without understanding the nature of the job that you guys have to do, sometimes, you know, are maybe, I wouldn't say unfair in their criticism, but it's because they don't understand. So you do take the time out to check to ensure that if it is a critical case, then it is given priority as opposed to something that can wait over time.
Yes, but you know, in healthcare, everybody thinks their case is critical.
Okay, well, thank you so much, everyone, for taking the time out with us. We do appreciate, as citizens and as patients, the initiative that you guys took to give us a little treat, and it was well received, and we thank you so much and your department for the work that you guys are doing. Continue to keep it up.
Thank you.
Yeah.